Doctor, I bring in all the wishes and greetings to you from all the faculties and the team of Speed Medical Institute to Dr. Neelamkumari Jat for getting a rank number 2 in DM Clinical Haematology in the session of NEET SS 2021. Amazing rank, great rank, topmost. Congratulations and best wishes to you.
Thank you, sir. Thank you, sir.
And excellent, doctor, and really great to have you today in the session. And also want to know a little on your background on medical career so far.
Yes, sir. I have completed my MBBS from Sage GS Medical College and KM Hospital, Mumbai. And after that, I pursued my DNB medicine from Pune Hospital, Pune. And after that, I was working as ICU registrar for a year post my DNB medicine. And then around few months back, I even started I thought of pursuing a career in medicine because in my first attempt at NEET SS 2020, I got rank 103, All India rank. So I was not getting a seat there. But a few months later, then I realized that I should not leave my passion and give a one shot once again. So then I prepared for DM hematology, and then I got it.
Great, doctor. And can we know your preparation strategy when you started, how you prepared? Can you share your strategy and experience to end up in rank number 2 today so that it will be beneficial for more students who are preparing for it?
Yes, sir. So I would suggest to start from the basics. Speed helped me all along. So it was a guidance pillar based on which I, fortified all my notes and everything. So first thing I would do was watch my videos of speed in classes, and after that I would read the same topic from starting from Harrison. Many people had read Hoffman and Hofbrand, but I had read from Bethesda and ASH SAP. So that was very good for benign hematology part, and that helped. For malignant hematology, I was not very confident and sure. So for that, I also ended up reading WHO, but I would not suggest because usually the paper is not that tough. So even completing notes from app speed classes is more than sufficient. But for benign part, I must advise to top it at, fortify your notes with ASH SAP and Bethesda. That was very good. And along that, tests.
And were you able to watch all the videos and complete the sessions?
Yes, sir. Yes, sir. Yes, sir.
So were there grant tests which were given were useful to you?
I was not very regular with the grant test initially, but in last 1.5 months, I had given almost 70% of the grant test. But in that, I used to get rank around 180 or 120, or once only I got rank 25. But then I thought of not leaving the hope and, continuing preparation. I also remember one of your interviews saying that in which you had told all students, there was one guy from cardiology who had started 15 days ago and then was able to get rank 23. So that was also sort of, inspiration for me that you should not give up and you should keep reading and keep reading.
Excellent, excellent, doctor. And what will be your preparation for general medicine? Because in NEET you would have had 40-60 pattern, and also NESS also had almost same pattern this year.
Yes, sir.
What was your strategy?
I would say that reading up whole Harrison for medicine would be, not a good strategy. So for that, I completely relied on speed videos and assessment and those MCQs which are given in the app, completely on that. And it was more than sufficient because I had read medicine from Harrison thoroughly during my DNB days. So I was pretty sure with that. But, just to brush it up and revise, app was more than sufficient. Sir. I would not suggest to read anything apart from app, that PowerPoint presentation and notes and revise MCQs from that also. I had also purchased Marvas and other MCQ book for medicine, but I had not solved it. So that is going to be a waste of time, because even in general medicine, sir, many questions were asked from the hemat part also, and topics to be read from medicine. What I had seen the pattern in past few exams was to give stress on infectious disease, because that they end up asking more, and general oncology also. And apart from that, I think neuro was asked more. That's it.
Great. And at this juncture, would have, many people would have helped you so far in your career. I mean, an opportunity to thank, and you can thank those people who, I mean,
Yes, sir.
of a great help to you.
Yes, sir. Sir, as it is, there are many people who have helped me to come to this stage, but one special person I would like to mention is my mother. She has always been an inspiration for me, and she stood by my side every time. Because during the preparation also I got pregnant, and today I'm like 26 weeks. So in my first trimester only, I had a lot of issues, vomiting and everything. So my mother was there with me all the time, and I was able to give in a good health and dedicate my complete time to studies from post Diwali. So those 1.5 months had helped me. So it is my mother. It's always been her. And there are many other, my siblings, my father, my in-laws, but my mother is the greatest inspiration I've ever had in my life. So I would, and I also, waited that someday in my life I should get an opportunity to thank her during one of my interview. So I'm very happy for that, and I was looking forward to it, that I get to meet and I get to thank her in one of the interviews.
Because they all along keep on thinking about us. I mean, because I mean, any point of time, the upbringing, not only upbringing in all aspects, I mean, continuously they have constant thought process only on the children. I mean,
Yes, sir. She
definitely.
always inspired me to do better. She always told me, you can do better, you can do it. And there are many points, ups and downs and lows, when you start feeling that, no, you cannot do it, you are not worthy of it, you cannot do DM, like that. But then these are the people, these are the gems in your life that you need, who keeps on, telling you, no, to help you realize what is your potential. And my family, especially my mother, has been one of that.
Really wonderful, doctor. Once again, I wish you all the best,
Thank you, sir.
all
Thank
the
you.
success for a great career in specialty of clinical hematology,
Thank you, sir.
and your presence will make a difference for the specialty itself. And
Thank you, sir.
people, thousands and lakhs and millions could have been your patients in future, and your service to them in your preferred specialty, and it's going to be great. And for that,
Thank you,
for
sir.
all your medical career from now on, all the best and all the wishes for all your endeavors. And God be with you and bless and make always be happy. And you make people around you happy. And best wishes to you, to your family members, friends, and relatives all around you. Thank you very much.
Thank you, sir. Thank you so much.
Thank you.